Hi, I'm Ben Asriel, a newly graduated doctor from the Icahn School of Medicine at Mount Sinai. I'll be staying at Mount Sinai for my residency in emergency medicine. And I also am one of the co-leaders of the COVID-19 student workforce at Mount Sinai, which is the volunteer group of medical graduate and nursing students who have been helping with the COVID response at Mount Sinai. It's been truly incredible to see how much work medical students can do, important work, especially when you take medical school away. So just how much potential energy exists within us is really humbling. So we total in the last 2 months, we have worked over 100,000 hours. We've had, I don't know, something like 80 tasks. We were able to get up and running really quickly. We had a lot of trust with the administration. They trusted us to make decisions. We focused on autonomy and making the students autonomous and allowing ourselves to be nimble and quick so that we could really move fast. That was facilitated by the fact that we were able to get elective credit so quickly. So we knew that our work was being valued officially by the institution. I'm going to be an intern at Mount Sinai in emergency medicine starting in June, July.
So my name's Sahi. I'm a third-year medical student at Mount Sinai. I've been helping during the pandemic by overseeing some of the telehealth task force tasks. So I'm a third-year student, which means that I was on clinical rotations when the pandemic hit. And as you may know, the school was pretty quick to cancel our clinical rotations and move all students outside of the hospital in mid-March. So what that meant was all preclinical students ended up switching to a virtual format, but MS3 and MS4 students no longer were responsible for any coursework because we weren't able to be in the hospital. So that meant that those students were able to kind of commit their time to volunteering. And our student body came together and created a student volunteer workforce. Over the past 2 months, we've had 18 individual tasks with over 330 telehealth volunteers working from all over the country. Our tasks can be broadly grouped into 5 categories. They're chat and text-based patient care, delivering test results to patients, remote support to inpatient teams, and remote outpatient care, as well as a Narcan training program. I'm interested in internal medicine, hopefully applying it to cardiology in the long run.
Hi, I'm Zena Huxley-Riker. I'm a recent graduate from Mount Sinai. I was one of the vice presidents of the student council, and through that, I took on a leadership role in the volunteer student workforce to respond to COVID-19. This has really shown to me the inequities in our healthcare system and the disproportionate effect that this pandemic is having on certain populations in our city and in our country and in the world. And I think I went into primary care because of the work that I hope to do for my communities and to address and combat those inequities. I think it was a mix of emotions. I mean, I think we all as medical students understand why our graduation was virtual, but obviously this was something that we were looking forward to and have been excited about for years and years. But I think I was really touched by all of the efforts that went into making commencement feel as special as it did, despite it being virtual, and feel really lucky to have had the celebrations that we've had.
So my name is Grace Mosley. I am just finishing my 6th year in the MD PhD program. And so I defended my PhD in December and have been in sort of a transition period from research back into medical school. And in the midst of all that is when the pandemic started. So I found myself in a fairly strange position because I was surrounded by so many people that were on the front lines and felt like they were really helping, and I couldn't really do anything, or it seemed like it at first. And then the labs closed down. Students at Sinai put together a pretty large structure of a lot of different volunteer opportunities. So I mostly got involved with some of the PPE efforts. I did a lot of mask fitting to make sure that staff were in the appropriate size N95s. And I've also helped manage an inbox that is full of offers for sale and donation of PPE to the hospital, as well as doing some pharmacy deliveries for some of our patients at the EHOP clinic.
So hi, I'm Katie Donovan. I'm a rising fourth year med student at Mount Sinai. To give some background, I was on my clerkship, actually pediatric surgery rotation that I was loving back in mid-March, and they kind of sent us home for our own safety in the midst of that clerkship. So I went from being very busy to being very not busy at all. I kind of did some brainstorming about ways to support residents and attending physicians and ultimately hospital staff with childcare and just at home errands, pet care, things like that. And that's how I started Sinai Together, which was a volunteer organization, still is a volunteer organization that organizes med students and grad students into a volunteer corps, and then matches them with physicians or nurses or social workers, any hospital staff that need help at home. So on the whole, we actually provided mostly childcare to a lot of resident physicians, and some of those arrangements are still going on, and I get pictures from my colleagues and stuff all the time.
My name is James Blum. I'm currently a fourth year medical student at the Icahn School of Medicine at Mount Sinai. I'm also pursuing a master's in public policy at the Harvard Kennedy School. I'll be starting rotations again in July, and I plan to apply into emergency medicine. I've been involved in the student efforts more from a leadership coordinating perspective. And it's been so incredible to be able to have that role, to see students be involved across the health system, and to feel like that there's something that I'm able to do. We had students who were down at Beth Israel Hospital working in the pharmacy there. And so they were helping to make sure that the floor pharmacies were stocked from the central supply room. They were helping make sure that they had crucial drugs during this time, like propofol to intubate patients. And we're really critical there from an administrative perspective. We also had students that were helping bring PPE together throughout the city. And then we also had students, who were helping source PPE. I remember there was one student who is fluent in Mandarin and was helping work with supply chains in China. The whole health system and hospitals across the country are facing kind of financially tight times. So I think that will be one challenge in making sure that we're maintaining support for the school, especially for scholarships,